In our summit rounds this week, we had a discussion about the risk associated with medical treatment. And I wanted just to give you my thoughts on the risk of medical therapy. Virtually every treatment in medicine is associated with some risk. And the decision to undergo medical treatment is an analysis of the understood or predicted benefit compared to its associated risk. Now, good medical care involves a good history, physical exam, and diagnostic testing, and an accurate diagnosis. So we really need to make sure that we make and establish an accurate diagnosis before we jump into treatment. Treatment really also ought to be comprehensive and interdisciplinary. So it's not just one treatment that's provided, but it's a treatment plan. By treating with an interdisciplinary plan, we mitigate risk because we're not reliant on one therapy. One example of that is pain is the problem and the treatment is narcotics. And if we go, well, you have pain, therefore you need narcotics, and if you still have pain, you need more narcotics. That would be like the extreme example of the wrong way to do it. Every medical therapy, though, has associated risk. Taking a medication has risk. Chiropractic manipulation, which came up in our discussion, does probably have a very small risk. Physical therapy can have a small risk. When we start getting into some of the other treatments, such as injections, radiofrequency ablation, and other non-invasive or minimally invasive procedures, there is risk to those procedures. Surgical intervention of all of the treatments, and I'm a surgeon, carries the highest risk in general. And it's very important for us to understand this analysis. And when you're talking with your provider, and especially when you're talking to the surgeon, I think it's wise to spend some time talking about what is the likely benefit of this intervention. What else am I doing that is associated as a treatment plan to mitigate risk? And then what is the risk of the intervention? And then use that analysis to help guide sound medical decision making.